We're talking about chubby cheeks today. That is something that often upsets younger people that want to look a little bit more mature. Buccal fat is fat tissue which everybody has, is quite normal. It sits in the cheeks. You can see that more in babies, and the buccal fat gradually disappears anyway, but you can have it removed if you don't like that. The typical location of the buccal fat is in these areas. If you feel your cheekbones and your masseter muscle when you chew, in front of it there's a little dip where you can feel your teeth, and this is normally where the fat comes out. Now, the average adult has approximately 7 to 11 mils of buccal fat on each side, and the amount that can be removed safely is approximately 3 mils. So it's a small proportion, but most of the buccal fat sits behind the muscle, behind the temple, where you don't necessarily see it. Removing 3 mils is a good amount. I normally do that under local anesthetic, which means patients are asleep. You get an injection, make a little cut after everything is numb in the inside of the cheek, remove some buccal fat. So the buccal fat comes out quite easily, but there will be a point when it's a bit more difficult to remove. At that point I would stop, cut it out and put stitches in. And for you to be able to see the full results, it can take about 3 months. Don't get too frustrated if you don't see the improvement straight away. Buccal fat removal is a fairly subtle operation. What that means is you are less likely to get an overcorrected look, and most patients prefer very subtle look. In some cases, there can be other reasons why people are not happy with their full face. It's not always the buccal fat. One of the reasons is that some people have fullness in the cheeks here, the lower cheeks. That doesn't necessarily respond to buccal fat removal, but you can do things like liposuction. They can remove this. Also, some fullness under the chin or under the jawline can be massively improved with liposuction. It gives you more definition and just emphasizes the jawline, which is an attractive feature. Some people get very wide cheeks here and they say, oh, I don't like this. And that's often due to what we call masseter hypertrophy. So it's basically tooth grinding. If people grind their teeth, that can give you very strong muscles here, and that can be addressed sometimes with Botox injections, which can make the muscles less prominent. There can be other things apart from prominent buccal fat that can give you full cheeks, but in many patients, buccal fat removal is a fairly nice, simple procedure with an acceptable risk profile to give you a nice appearance.